Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sarah Figueroa, which is the director of the institute, and we will be talking about diabetes type 1 and 2 and how these stem cells can help with patients that have this disease. Hello, doctor. How are you?
Very good, Luis. Thank you so much. Thank you for having me. Always a pleasure to be here and do these podcasts with you.
It's great to have you back. Doctor, so how can we help patients that suffer from diabetes with stem cell treatment?
Yes. Well, diabetes type 1 is considered an autoimmune disease. Type 2 diabetes is not. So we can address both in slightly different ways. Diabetes type 1 as an autoimmune disease, it's basically what an autoimmune disease, and I've mentioned this before in past podcasts, but I'm happy to reiterate. An autoimmune disease is where the body creates antibodies and attacks itself. Auto means self. And so these antibodies attack the beta cells of the islets of Langerhans in the pancreas, where insulin is produced. And so these cells get damaged and insulin is not produced on demand. And that is basically what diabetes type 1 is. Now, how stem cells can help with that is literally going in and two things. When we have an autoimmune condition, we want to do two things. We want to, first of all, stop the autoimmunity, which is trying to modulate the immune system in order to stop creating antibodies against our own tissues, number one. Number two, we want to regenerate any damage that's already been done. So we want to reverse the damage and then we want to stop the autoimmunity. Now, is that possible to do with stem cells? Absolutely. Okay. Particularly what we do is we use endometrial stem cells, which are very, very effective against autoimmune conditions. So endometrial stem cells, I know that'll be your next question, Louis, so I figured I'll answer it right now while I
Okay.
Endometrial stem cells are stem cells that are taken from the uterus of healthy young females. And we isolate the stem cells. They're adult stem cells, adult mesenchymal stem cells, and they're very, very effective for autoimmune diseases and again, to stop the autoimmunity and at the same time reverse the damage that the autoimmunity has created.
Me, as a diabetic, how would I see the progress with the stem cell treatment applied into my body?
Mm-hmm. So like objective proof as to whether or not it's working. That's a really good question. That's a really good question, Luis. You know how? So over some time, we want to give the stem cells, 3 to 6 months to really show what they're doing, and they can work and regenerate up to a few years. And adult stem cells can do that up to a few years and then die, which is what we want because we don't want them to continue to possibly create some sort of uncontrolled growths or tumors. And so basically the objective proof would be to check glucose levels and insulin levels. How much, for diabetic type 1, how much insulin use is being reduced. We find with our patients, we literally start to see blood sugar going down and in response to a meal and without having to take extra insulin. So that means that the insulin is starting to be created endogenously, which means inside the body. So we see basically the need for injected insulin to go down, which is a very, very objective measure of how the stem cells are working.
In this case, is the pancreas that is getting the regeneration, right, doctor?
That's right. That's right. So, yeah, the pancreas is being regenerated with the stem cells in diabetes type 1. Now, in diabetes type 2, I will specify. In diabetes type 2, it works a little bit differently. In diabetes type 2, the insulin is there and it's being produced by the pancreas. That's not the issue. The issue is that the peripheral cells, where the glucose is being the blood sugars, which are the glucose, where they're supposed to be uptaken into the cells, are not responding to the insulin that's already there. Now, what tends to happen is in patients that with bad lifestyles or lifestyles that are not conducive to good health, they tend to eat a lot of sugar, carbohydrates, things like that. So there are different theories. And one is that there's sort of a down regulation. We call it a down regulation of receptors on those peripheral cells where the insulin is there, but the receptors have been down regulated. So they don't respond to the insulin. Okay. Number one, when there's always too much sugar around. In that case, when there's a lot of sugar around, there's a lot of insulin, and when the cells are being bombarded by so much insulin all the time, they just don't respond. Okay, that's one thing that's going on.
Mm-hmm.
Another thing is, for whatever reason, when the fat cells, when there are a lot of fat cells, they don't respond to the insulin, and the same thing happens is that the insulin is there, but there's no blood sugar taken up into the cells, so it shows a higher blood sugar level in the tissues.
Okay. So, doctor, me as a patient, once again, actually, I was a diabetic for a while, but that was something that it had something to do with my thyroid.
Oh,
So,
yes. Yes.
I was like, well, my doctor told me that I was not a diabetic anymore, but I don't know. I actually feel pretty well once my thyroid was removed. So
Oh, yes.
yeah.
Yes,
So
and that could happen. A lot of patients have we call that secondary diabetes. And that's secondary to something else that's going on, which is actually causing the diabetes. So I'm glad that in your case, and a lot of these endocrine diseases, endocrine meaning hormonal diseases, insulin is a hormone, the thyroid produces hormones. A lot of these endocrine diseases are all related.
yeah.
If one aspect of the endocrine system is off, the rest will be off, or it's very likely that they can be off.
Oh
So yeah,
wow,
that's a
yeah.
good point.
So when I was a diabetic, I felt really bad. It was terrible. My blood sugar was fluctuating. It was going up and down, up and down. So in this case, does it require more than one visit, doctor, to see the best results?
It's possible. Our goal is we usually have results and very satisfactory results in one treatment. And our goal is to do everything right so a patient doesn't have to come back. So we use the highest number of stem cells that we can. We apply the stem cells in various different ways in order for the body to respond to them. So in this case, with any autoimmune condition, we apply them at least two ways. One is intravenously, and the other one is into the lymph nodes, because the lymph nodes is where the immune system begins and resides, and that's where the autoimmunity resides also. So we do that with an abundance of stem cells. We also have a very, very thorough and comprehensive pre and post treatment protocol. Our pre-treatment protocol involves a total detox program with a nutritional IV with antioxidants and B vitamins, and we follow that up with 4 nights of an organic caffeine suppository, as well as B vitamin shots. And that's our total detox program, which we always incorporate into the treatment. as well as exercise with oxygen therapy or hyperbaric oxygen, so some sort of oxygen therapy, as well as age-appropriate growth hormone therapy, and our proprietary stem cell enhancement formula, which is a blend of key minerals and herbs that just fortify the body and the stem cells to keep working. So we do this up to 3 months. Our patients go home with a lot of this stuff so that they're on track for about 3 months.
What will be like the youngest person that you have treated, diabetic patient, and what would be the oldest person that you have treated with diabetes?
Oh, that is a very good question. Because diabetes, especially diabetes type 1, is so much, well, nowadays there's so many different types of diabetes, or at least more than two. and But diabetes type 1 begins so early. Usually it's a juvenile onset, which means that it starts in childhood and almost at birth, from birth. And so we treat children we've treated 4 and 6-year-olds up to 80 years old with diabetes, with very, very good results. In every case, we've seen insulin needs going down and almost eliminated, if not eliminated. Especially, I'm glad that you mentioned that, because the sooner that we get to a patient with the younger the patient, the better the results. So it's always been very, very good. And same, just to mention children and autism, for instance, the sooner they get treatment, the better the results, because they're still very plastic, and it's easy to modulate the immune system at a younger age, and neuro regeneration as well.
Okay. And doctor, what will be the best way to get in touch with you?
Yes, prospective patients can reach us at by email, info@stemcellhealinginstitute.com. They can check us out and send us an email from our website, www.stemcellhealinginstitute.com, or www.stemxcure.com, as well as visit us on Facebook, Instagram, YouTube. We have our videos and podcasts on YouTube, Spotify, and Anchor. Have I missed anything, Luis?
That is correct. And if you want to reach us, you can do it in the US by dialing 1-209-690-7836. And if you are in Guatemala, or if you want to contact us directly, you can do it by plus 502-4220-7297.
That's right. And that 502 number is also hooked up to our WhatsApp contact also, where we have a lot of patients contacting us on WhatsApp. So that makes it easy for patients as well.
And that's right, doctor. Anything else you would like to add to this podcast, doctor?
Nope. I think that's it. I think that's covered. We've covered a lot of ground today, Luis.
All right. So I will be talking to you next week.
Yes, sounds great. Thank you so much. You have a beautiful afternoon.
You too. You take care.